Living with fibromyalgia is not easy. Any chronic health condition has its challenges, but fibromyalgia can be more challenging than most. To understand why, let's delve into the history of fibromyalgia. Fibromyalgia, a chronic widespread pain condition, not only affects physical health, but also impacts independence, liberty, and quality of life. Living with fibromyalgia presents a multitude of challenges that extend beyond physical pain. It impacts sleep, making it difficult to rest and recharge, amplifying the sensation of pain. Additionally, fibro-fog clouds the mind, causing confusion and memory lapses, adding another layer of difficulty, combined with the lack of effective treatments and the disbelief from others. Even healthcare professionals, and most prevalent from friends and family, makes navigating life with fibromyalgia an uphill battle. The condition, affecting an estimated 2.9% to 4.7% of the population, often goes undiagnosed or misdiagnosed due to lack of accurate recording by NHS. However, we are now in a period of greater awareness than even 5 years ago. Fibromyalgia, formerly known by various names like fibrositis or muscular rheumatism, has been recognized throughout history, with notable figures like Frida Kahlo and Florence Nightingale thought to have it. In 1592, the term rheumatism was introduced by Guillaume de Bayeux to cover musculoskeletal pain that did not originate from an injury. Later, the term muscular rheumatism included conditions like fibromyalgia that did not cause deformity. William Balfour described tender points in 1815, which eventually became crucial for diagnosing fibromyalgia. François Vallée used neuralgia to describe what he thought was referred pain from these tender points. Stress was also thought to be a factor, with neurologist George Miller Beard citing widespread pain, fatigue, and psychological disturbance. The 1900s introduced new terminology like fibrositis, muscle hardening, and myoglosis, but Sir William Gower's definition of fibrositis stuck. The symptoms that Gower's put forward will ring true with fibromyalgia patients today. That is spontaneous pain, sensitivity to pressure, sleep disturbances, fatigue, cold sensitivity, and aggravation of symptoms by muscle overuse. In the first decade of the 1900s, cocaine injections were suggested as a treatment. However, the name fibrositis persisted, reflecting the prevailing thoughts about muscle inflammation. During World War II, soldiers were thought to be more likely to have fibrositis due to stress and depression, leading to the term psychogenic rheumatism. The debate on fibromyalgia's origins continued, with arguments over psychological and physical factors. Acceptance grew over time, with textbooks affirming its existence. In 1972, Hugh A. Smythe's work identified fibrositis as a widespread condition separate from myofascial pain syndrome. He emphasized the role of trauma, emotional distress, and non-restorative sleep in exacerbating symptoms. In 1976, the name fibromyalgia was adopted to represent the new understanding about the condition, emphasizing pain in muscles and connective tissues. Research in the late 20th century confirmed common symptoms like pain, fatigue, and poor sleep in fibromyalgia patients. Genetic predispositions were also identified. The turn of the millennium saw treatment guidelines established and medications like gabapentin and amitriptyline offering relief to many. The American College of Rheumatology criteria, initially introduced in 1990, underwent revisions in 2010 and 2016, and NICE guidelines were introduced in 2021, reflecting evolving understanding and practices. These criteria have been validated against their earlier versions but are less arbitrary than relying on tender points. Research has continued to shore up previous findings, but other theories and research are looking at things such as inflammation of the fascia, extra nerves on blood vessels, small fiber neuropathy, and immune system abnormalities. These require more investigation, and we are also seeing work being done to establish subgroups of fibromyalgia, recognizing the heterogeneity of the condition and paving the way for more personalized treatment approaches. While challenges persist, including limited access to specialized care and the ongoing debate over optimal treatment strategies, increased awareness and ongoing research offer hope for improved outcomes and quality of life for individuals with fibromyalgia. Organizations like Fibromyalgia Action UK have been instrumental in supporting patients and advocating for better access to care. When seeking diagnosis and treatment, fibromyalgia patients often encounter disbelief from healthcare professionals. misunderstanding from family and friends, and challenges navigating social systems. Current methods of diagnosis rely on comprehensive assessments of symptoms and medical history, with a move away from tender point tests, and lean on ACR 2016 guidelines. Healthcare professionals play a crucial role in supporting fibromyalgia patients, providing empathy, understanding, and tailored treatment approaches. In conclusion, fibromyalgia remains a complex and often controversial condition, but ongoing research and advocacy offer hope for improved outcomes and quality of life. For more information and more research references, please visit our website.